Hey guys, Dr. Nick here. I just want to give you my rundown for day 3 at the Alpstein clinic. Today was a great day. As you can see, I'm in the train station, just waiting for my train, so I thought to be efficient, I'm going to do it now. So, it's actually around 8:10 local time, so I've been at the clinic for 12 hours, but it felt like nothing because it's so energizing, and truthfully, it's so fun when you're like around people, like-minded people, and people that actually care, because I got to talk to each of the doctors, and they actually do care about their patients, and they actually do want people to afford what they have available. So I always see doctors trying to give discounts whenever they can. And so in the morning time, I got a chance to be around the nurses, and we went through a lot of different therapies, from the endotherm, which is kind of this hyperthermia treatment, and then we had contact thermography that we did, also special HRV, and then we got a chance to also be introduced to the different IVs that do the infusions. And then I actually got one. If you saw my story today in my post, I actually was lucky enough to get an infusion there, and that was great. It was a great feeling just to see how it is to be a patient, because I'm not really sure sometimes, sitting on the other side of the table in a sense. So that was really fun. The nurses were really nice. Everybody's always been so nice to me, and always trying to teach me or ask me what else I want to learn or what else I want to see. And they even showed me the process, how they go through the records and all that stuff. And the nurses are great too. They're very compassionate. They care about their patients. And all these nurses usually or used to work in hospital settings, and now they really appreciate being in this kind of setting because they really feel that they can impact their patients on a different level, and that's a great thing to hear. And in the afternoon time, I had a great experience. I was able to be with Dr. Joseph. He's the medical doctor and also the dentist. And today we went. Sorry guys, my video got cut off. But I'm just trying to say, now you see it's getting really dark waiting for the train. But the afternoon was great because I got to be with Dr. Joseph, I told you, MD DDS. He was pretty amazing. We had a really great time. He talked me through his different procedures as he was taking care of patients, and I love the fact that he took time to explain what he wants to do to the patient or what he thinks might be necessary, in terms of maybe specific specialized bite guards or oral mouthpieces, or in terms of different procedures, or if we have to take a root canal out and why, or in terms of other extractions, or what he sees if there is a cavitation, because he does have a CT cone beam kind of x-ray, which it's a 3D one, so you can really see what's going on and where the infection lies when there is one in the background, when you can't really see it on a panoramic x-ray. So that was really cool. And then at the end of the day, which was pretty crazy, we had an emergency patient, and we had an emergency surgery, emergency extraction, because that person had a pain in their teeth, in their tooth. I think it was maybe tooth 2.6. I think it was one of the possibly the first upper uh, left molar, and that was pretty fun to be able to be part of that physical surgery, um, where I got a chance to see how he does it, how he extracts the physical tooth, how he does PRF, platelet-rich fibrin, how he packs it back in, and then doing a PEMF therapy right after it, and then giving the patient instructions after the fact in terms of healing, RO optimal healing. So that was really amazing, and he talked through the whole procedure with me, so I can get an idea of what was going on. And best thing about it was the patients, all of them allowed me to be there, to be able to be part of the procedure and learn from Dr. Joseph, because of course I'm not a dentist like I always say. However, I have to know something because it's an important factor, because we talked about a lot of implants that fail and why they fail, and what he's seen from his studies, because he's done a lot of education and he's very evidence-based when it comes to these, when it comes to using different methodologies and different treatments, and always tries to optimize himself wherever he can. He's always open to learning more and new ways of doing things. So that was pretty amazing overall too. And we finished a little bit later, but again, see, he stayed the whole time with the patient, making sure that they were comfortable with everything that they were doing, that was happening, and just explain what we're going to do, did it, and then of course was happy enough to stay extra long to be able to comfort the patient and make sure they got all the therapies that they needed so they can optimally heal. So again, today was a great day. It was a long day, but it doesn't feel like it at all. I'm not gonna lie, I have so much energy. I'm so pumped. I could probably be there for another 12 hours, but I have to be there in less than 12 hours. So I'm fine with that. I'm excited for tomorrow because I get to, I think, shadow a little bit more of the nurses and actually look into leech therapy, and then go back to some of the doctors and shadow them again. So that's day 3 finished for now, and hope you enjoyed that. Stay tuned for tomorrow for my update on day 4. Good night from Gus, Switzerland.